If you're a driven, active person who wants to reach and pursue a higher quality life with some ambition, then guess what? This podcast is for you. This is the Driven Athlete Podcast. What's up, y'all? It's your man, Dr. Kyle. We got a really cool guest here with us today. Finally, we got her in. We're super excited. It's Dr. Danielle DePiero with Wellness First in Juno Beach, right?
Yeah.
So thank you for coming in. Like I said, you were like one of the first ones on my list. I was like, man, I got to get Dr. Danielle in here. And we got you. So I'm excited. Tell people what your title is, where you're at, what your practice is, and what y'all do.
Okay, yeah. So we are located in Juno Beach, called Wellness First. We are an integrative primary care practice. And so I'm a family doc and I'm an osteopath. And so I joined about 6 years ago. It's in my 6th year.
With Dr. Hadley?
Yes, Dr. Hadley's my partner. And we've got a couple other physicians now that we've hired and brought on, and we're growing. And I think what really sets us apart is that we really take full ownership of our patients from a primary care perspective. And we're doing so with like root cause in mind. And so we call ourselves an integrative practice, where we are marrying conventional medicine, which still has its place, absolutely. But then we're also addressing patients' needs from a root cause perspective, where we're really listening to their story and recognizing that every individual has different needs, goals. And so we are really trying to find the why behind the things that ail them, or patients who just want to maintain, incredible health and vitality. We have a wide, broad spectrum of patients who we see. Yeah. Beyond that, like the conventional Western medicine stuff, and then you have the other side, to the integrative side, right? The wellness side. What do y'all do with that? So many things.
Yeah, tell everybody.
Okay, so, well, really, foundationally, the foundational piece is first, right? Like, you're focusing a lot on nutrition, you're focusing on stress management, you're getting them sleeping better, you're reducing inflammation, you're balancing hormones. And so that's really like bread and butter of what we're doing. And not everyone needs our additional services, but yes, we do offer things like IV nutrient therapy, IV chelation. We do something called IV ozone, which is really, really cool. And we're even bringing on new services all the time. And so that we try to be kind of a one-stop shop for our patients, recognizing that, like I said, not everyone needs those modalities, but we do find that when we're sitting with the patient for the first time and you're really hearing their story, you really got to focus on those foundational things first and get some consistency there. And then, you can certainly bring on these cool integrative things to add on, but it's what we do day in and day out that really is going to give you the most reward or
makes
return.
sense.
Yeah,
makes sense. Is there a type of clientele base that you feel like is your wheelhouse? Like a certain niche?
Yeah, I chose family medicine because I enjoyed seeing all ages, and we do see 14 and above, but probably our bread and butter is in ages of like 40 to 65, and those are the people that have really, younger than that, sure, you have things that you can work on, but people kind of feel their age around 40 and beyond. And so they're like, okay, now I want to really invest in my health. And so I love the people that just want to lean in and learn. And so I kind of say that I'm in the business of giving back people like hope and encouragement and empowerment, because doctors unfortunately they can kind of say, you have this X diagnosis and you're going to have it forever. And I like to say, actually, that isn't true. Like, we can actually reverse this, and this can absolutely get better. And so it's amazing what just kind of inserting hope back into their health does for them.
Yeah, I totally agree with that, because I see it a lot with our sports orthopedic type people. And I would agree, 45 to 60, 65 year olds, it's like the great demographic to work with, because they're all in. They're like, tell me more about this. How can I get better? Am I going to be like this forever? And it's like, your shoulder issues, like, it doesn't have to be like that forever. Like, you can get fixed and make this feel better, I promise, and get back to working out and exercising. Would that be cool? Like, I can do that? Like, yeah, totally. What do you find for you that's like, that's not true, we can reverse this? What kind of stuff?
Ooh, so many things. I think the fun things are those chronic diseases that ail a lot of Americans, right? Heart disease, obesity, metabolic disease, autoimmunity, even cancer, right? And so I don't think there's one thing that you can't reverse. I believe the body has an amazing ability to heal itself when given the right tools. And we don't talk enough about that. And so it's really an exciting time to be in medicine because I think people are asking for more and they're kind of pushing the envelope for like, actually, I don't want to take this medicine. Like, what else can I be doing?
Right.
And those are
Like, this can't be it. Is this it? Like, there's got to be more, right?
Exactly.
Yeah.
Exactly. And so, yeah, the body is amazing.
What type of, you said autoimmune, what kind of autoimmune disorders that you see that could be reversed?
Hashimoto's thyroiditis, that affects a lot of females.
Okay.
And so I've seen that reverse and totally resolve. I've seen patients with multiple sclerosis who, things like IV ozone can be really incredible to reverse. Yes.
Wow.
And
because I've always understood MS to be like terminal and just completely, it proceeds,
Right. I know. And so that's where diet changes and reducing inflammation and getting them sleeping. And even that is something where I feel like you do need something like IV ozone to really help. We have a lot of patients, not a lot, I should say. I should say a handful of patients that we work with the MS that it's really keeping them from feeling a lot of the symptoms that MS can cause.
Like really debilitated.
Yes.
And more like the remission.
Yes.
Talks about IV ozone therapy. What exactly is that?
Okay, so IV ozone is just a way to give. So ozone is 3 oxygen molecules where you use a generator to push them together because O3 or ozone is actually a very unstable molecule. And so we can inject it into joints, and I do this as a regenerative therapy for chronic musculoskeletal complaints, but we can also put it in the blood, and we do so, we use a machine that drains the blood into this, it's like an egg, and then you ozonate that egg, and then you give it back. And so it's a closed loop, and ozone in the body it has so many benefits, but it kind of acts as a sterile molecule, so actually can kill chronic viral illnesses. It can stimulate NAD, NADH, which actually improves energy, and it can actually also reduce pain and reduce overall inflammation.
Cool.
Yeah.
So sterile, it can actually, okay, that's really cool. And then in general, I've heard this a lot, and I want to hear what your definition or explanation of this. Reducing inflammation in the body. What does that mean? Like, what is inflammation, and then how do you reduce it?
Oh, great question. And so, I should say inflammation is actually the body's way of healing itself, but too much inflammation is also not a good thing. Right. And so when you get a cut on your arm, what happens? It gets red, it gets hot, it's painful, it's pain to touch.
Right.
But when we put in inflammatory foods, when we are not managing our stress levels, when we're not moving enough, when we're exposed to toxins, be it heavy metals, pesticides, mold, that has a negative effect in the body, right? And so those exposures or those habits can build. And so the body then gets overwhelmed. And then that's when disease can begin, right? That's where we see atherosclerotic disease. That's where we get obesity. So that's where we get autoimmunity. Even I think cancer is what can ultimately stem from unchecked inflammatory process. So there are so many ways by which we can reduce inflammation, and it's kind of going back to those foundational things, right? And so that's really where listening to the patient's story and getting an understanding of their habits. And are they prepping their meals? Are they eating out most of the time? Are they getting to bed at a decent hour? Are they on their phones all day? Or how are they managing their stress? How are they addressing their heart issues, right? So we're not just physical beings. We are emotional, mental, spiritual beings as well. And so we often have to address those aspects of an individual.
Right. Yeah, totally. I was going to ask too, with inflammatory foods, what do you put in that category?
It's a good question. I don't want to
Is it individualized for people?
Yeah. So that's where it's hard to give a blanket statement. I think there's universal truths. Absolutely. Right. Canola oils. I wouldn't recommend that to anyone. Right.
That's one I've heard a lot. Seed oils. Brianna Davenport was talking about that.
Okay.
Seed oils and canola oil, I think, being one of those.
Sure.
Right.
Yeah. Refined sugars.
Refined sugar.
Alcohol.
Yep.
soy, not especially non-organic soy. I think gluten, only because we're in America and the wheat is just so genetically modified at this point. It is not really seen as food, but foreign. And so if we were living in South America or Europe, I think it'd be a very different conversation. But I have a lot of people that are not necessarily celiac, but definitely gluten intolerant.
Interesting. Any suggestions of wheat sources to go after then? Or are we just all doomed? It's like everything is just modified.
No, I don't think so. But I try to stick to like the sweet potatoes, white rice, brown rice, quinoa, those sorts of grains and complex carbohydrates. I've kind of, instead of pasta, I love spaghetti squash. I think it tastes better. But there are like things like brown rice pasta.
We've snuck in spaghetti squash with the kiddos.
It's good,
Didn't
right?
know the difference.
Exactly.
Like spaghetti. They're like,
right.
it's the best. Don't tell them it's actually vegetables. Exactly. They're like, what? I'm like, nope, that didn't say anything.
Yeah.
That's awesome. Okay, cool. Okay, good. A lot of the similar messages that's good. That's good to hear. What kind of cases do you enjoy the most then, people work with?
I love people that come in and they've been given kind of an absolute, like, you're always going to have this. And they come
and then just wowing them.
What?
And just wowing them, being like, I have hope. Like,
well, it's amazing just giving them like a different perspective, like just saying, actually, that is not true. And it's like joy comes back and like a light, like they physically lighten up. They're like, oh.
yeah.
And that is so rewarding for me. And they say, so that means like you can heal me. And I'm like, no, you are going to heal yourself. I am going to guide you. I'm going to listen, and I'm here to help support and give feedback and hold you accountable and kind of coach you through this.
Right.
Certainly. But like, you're the ultimate person that's going to heal yourself. Like, I'm trying to empower them to recognize that their body knows what to do, but it's just amazing what this does, right? Our thoughts, it's so powerful. Like,
100%.
right? Placebo effect is real. It's totally real.
Yeah. But
it's also amazing what just belief back into your heart and into your mind can do for a person.
I love that. Totally agree. It's something I heard recently with a mentor. They're like, you no matter what, we can't separate the mind from the body. Totally makes sense. Placebo is real. Okay. Can we leverage that then on the other end? Like with beliefs and perspective reframe, maybe to do the same effect, but in the reverse? I'm like, totally, right? I'm like, so I totally agree with you. I think it's totally untapped and like, it's just not really fully appreciated as much as it should be. So I would imagine then for you guys, like everything you're just saying, where you can't separate the mind from the body, we're spiritual and mindful and emotional beings. The mental health component is a major factor with healing and just being able to set ourselves up for success. What do you recommend for that? Do you send people to mental health therapists? What do you recommend? Books?
So I'll speak from personal experience. So I've been to therapy, love therapy. I feel like people are gifted in that way to help walk people through traumatic seasons and things that have happened to them.
Right.
For me, even just recently, I took the last 6 to 8 months to really do some inner heart work. I found that I didn't like myself. I was getting easily frustrated and I didn't know why. And I was like, why am I showing up in this way? And I was introduced to a woman, her name is Jackie Dorman, and she wrote an incredible book called The Heart Work. And it's written for men and women. And I took 4 to 5 months to really go deep and spend time and let myself feel things. And so I kind of became my own counselor, I kind of reparented a little girl that needed like some love and attention. And that honestly did more for me than anything else.
That's awesome.
Yeah.
I love that.
Yeah.
The Heart Work by Jackie
Dorman, Dorman. Highly recommend.
Cool.
Yeah.
Is she local?
No, she's actually out of Texas.
Okay.
Yeah.
How'd you get exposed to the book?
Chris Valentin, I listened to his podcast. He's also incredible. He's out of Bethel, and he had her on his podcast.
Oh, cool.
Yeah.
Wow. That's awesome. I love that. Like, 'cause, I mean, just like this podcast can be really enlightening and
Absolutely.
hopefully piecing things together for people.
Yeah.
I'm gonna check that out. That's really cool. I agree with that. I think the mental health component is like greatly undervalued or just underappreciated as much as it could be. We've gone to therapy, myself and my wife and I, like, just because we want things to be good. Not like it's bad, but like
Sure.
we appreciate and know that like that's the number one most influential thing. I think I heard from somebody, it was like the number one most impactful thing for somebody's like happiness is who would they spend the most time with? And usually a spouse, right? Or a significant other. It's like that's 70% of weight on your happiness is completely around that relationship. And I'm like, whoa, that's okay. It's meaningful. But that's cool. The heart work, I'm gonna check that out. So there's definitely, I mean, that's cool to hear that y'all have a huge correlation between that mental health and emotional and spiritual side with the healing process and physical. Married that with a necessary Western medicine approach when it's appropriate, of course, but then also not neglecting that there's this new wellness 3.0 thing you were talking about, side to health and wellness. What was that book you were talking about?
It's called Outlive by Dr. Peter Attia.
Yeah.
Yeah.
Medicine health 3.0, is that what you're saying?
Well, that's part of the book. I mean, it goes very in depth, but one thing that he talks about is something called Medicine 3.0. And I think that's really where we're headed. I hope that's where we're headed because people are asking why. Yep. Why do I have this? Why do I have to have this forever? And I think our generation and those coming up underneath it, like younger, are saying they're kind of they're not satisfied with the way that Western conventional medicine is doing things. And so I love that they're asking those questions and they're kind of forcing me to say, okay, Leah, let's go deeper. Because sometimes you can get complacent, right? And you're doing the same thing every day. But I love patients that ask me and kind of push me, right? Because I don't know everything, right? I don't want to stay stagnant. I want to keep learning and growing. And so my patients are also my teachers, which is really cool.
That's cool. Outlive, that's really interesting. Another, I mean, around that same topic with Western medicine and the direction and stuff like that. I heard an interesting thing, and it's not for everybody. Just get your opinion on this too, with pharmaceutical companies and health insurance companies and stuff like that. But with big pharma and medicine, which could be very helpful and great for people, right? And save lives, of course. But with some recent things that have happened in the past several years, right? A lot of questions and stuff have been raised and like new perspectives have been come up. And it's like, man, are they trying to help solve problems or are they creating lifetime customers? What are your thoughts on that? That's a deep one.
You're going there.
I know.
So I want to believe that people's intentions are ultimately good. Do I think that we have abused and taken advantage of in some ways? Absolutely. But I absolutely believe that medicine has its place and pharmaceuticals have their place. But I don't love when I feel like they're trying to push out alternative therapies or they don't give credence or credit to these things that are also equally beneficial. Like there is enough need for all of us to come to the table and have a space there. Like, why does it have to be your king being big pharma and no one else has a seat at the table?
And they're trying to muffle everything else out.
Yeah. I don't love that. Right. I don't love that. I think it has a scarcity mindset. Like we all have a voice. We all have something to contribute, so does that answer your question?
Totally.
Okay.
Yeah, for sure.
All right.
That's no, it definitely answers the question. What are some of the most common questions people ask you?
What should I be eating?
Yeah, I believe that. I hear that all the time too. What should I eat? What should I not eat?
Just tell me what to eat. And it's I would love it if it were that simple, but I have tried every fad diet under the sun. I mean, you name it, I've probably done it. And I have found for myself, I just love a good macro-balanced diet. I love fats, I love protein, I love carbs. I love it all. And so, but some people thrive in keto. Some people thrive, they thrive doing vegan, right? Or vegetarian, or Mark Hyman coined a term pegan diet. So is, a little bit of protein, but mostly fruits and vegetables. And so it's really hard to give a blanket, this is what you should be doing, because I also want to create empowerment of that patient to know, like take some data, like track your food, track your sleep, see like what works for you, because what works for you isn't necessarily going to work for me or your neighbor. And so I just try to create, like I'd actually try to ask questions back. Well, when you eat this, what do you feel? How do you feel? Right. And then have them kind of be their make their own solutions.
Right. I love that. I agree with that. The instilling the habit and then them learning it.
Yes.
At least for us, we've noticed in our patients, and I'm sure you're very similar, and other people we talk to too, the people that make the best strides are the ones that really lean in and they learn this stuff a little bit more, the education component.
Yes.
And they ultimately change their lifestyle habits for a long-term benefit, which is hard, of course. I mean, like, I've been doing this for 30 years. I'm not going to change, right? Like, oh, this is not going right. This is not going well, right? But having them change their lifestyle habits, learn this stuff, take a little bit of self-responsibility, but more importantly, like instilling these changes for a long-term change. I've definitely seen for our patients that we've had, those are the ones that make the best strides. Would you agree with that?
Yes, mindfulness. It's all about mindfulness, right? And checking in and, like I said, just listening to your body. The body speaks to us all the time. And I say, listen to those kind of cravings within reason, right? Like, I think women, sometimes they're like, sometimes I'm just craving red meat. Have yourself a burger, honey. Eat, right? You might need a little iron. Or I really don't feel good when I drink alcohol, but I do it because socially that's what everyone else is doing. Well, well, let's look at that, right?
Yeah,
so I just think we do a lot of things out of habit because everyone else is doing it. And we're really kind of not listening to the thing that was given us to kind of tell us and teach us what's best for us.
Makes total sense. Social norms, social expectations, social approval.
Yeah.
I think that's definitely, I would investigate that too. Like if someone's coming up with that, I would say, like, why do you feel like you need to get their approval to begin with? That's the problem.
Yes.
Or that's something I would investigate myself or look into.
Right.
That's not my role. That's not what I do, but that's just where my head goes. Right.
Sure.
But I don't do that. Okay. For you personally, what things have you done to you're a health professional, you're a doc, and went to med school, like definitely busy schedule, practice owner, right?
Yeah.
How do you navigate your own health and wellness and fitness?
It's changed over the years. And I used to really put all my energy into my nutrition and my exercise. I still focus on that a lot, but I feel like right now I've really leaned into my own belief system and my sleep and my quiet time and my ability to rest. We are really good at go mode. We are really good at you give me a diet, you give me, an exercise plan and I'll do it. And those things have value and they're needed. But I feel like we don't do a great job of just sitting with ourselves and letting cortisol come down and letting parasympathetics kind of come up and giving the sympathetic nervous system a break and putting away the phone and just connecting with people relationally. That, I believe, is so important, and it's not necessarily given a lot of thought anymore. So for me, it's building relationships, making time for other people, thinking about someone else, not just myself, getting to bed at 10 o'clock. I love my sleep. It's so important to me. I feel amazing when I, get my 8 hours.
Yeah.
So, so I think as of late, that's where I've leaned in a lot of my time. But yeah, I loved exercise. I prep most of my meals at home. But yeah, I still like to eat out a little bit, but a lot of that is done, at my house.
Yeah.
Yeah.
Gotcha.
Yeah.
It's a while back, I had reached out to you about some blood values and stuff like that. I was like, man, I need to investigate these blood panels. I just wasn't feeling great in general. And, someone locally, I went in and got some blood work done and some things were off. And I was like, what? What the heck? And I definitely believe it was stress induced. I had some alopecia stuff going on too, some patchy on my beard and my face. And I was like, what the heck happened? Right.
Yeah.
And some of these values are off too. And a mentor of mine had described similar things for him as well. And I was like, what's going on, right? I want to investigate this a bit more. Why? And in my own opinion, I was like, this is totally stress induced. It's stress and anxiety, right? I'm a dad. I have 2 kids, got a spouse, my wife at home, running a practice in the business. I'm seeing patients, trying to navigate my own health and fitness and wellness and other projects I'm working on simultaneous. So I'm like, why? Like, what's going on and how can I fix this and address? And one of the main things that this mentor was telling me was like, what's your sleep schedule like? And I was like, I don't know. And my kids wake up, I'm up. If they're up early, I'm up. My wife handles that mostly now at this point. And luckily, my daughter's a little bit more consistent with her sleep. But my son, like he's only a year and a half, so he's sporadic sometimes. And she handles that mostly. And she's a warrior. She's a superhero. But anyway, like my sleep was definitely not consistent. He was like, dude, get that on track. Be militant with your schedule of like hard stop, 9:30, go to bed. Because if you're getting up at 4:45 for a patient at 6 or something like that, right?
Yeah.
Or a patient at 7, you got to get up at 5:30. Like you need to get like, what do you usually need? And I'm like, 8 hours. If I don't, I notice a difference, like you said. Even better, maybe 8.5. Totally. This is the way I am. Yeah. But I was like, all right, so then I need to go to bed 8.5 hours before that. And I'm like, no chance, can't do that. I won't do that. Like, oh, that's what needs to happen, right? I have an idea, go to bed earlier. It's like, what? But that was the first thing they suggested. He was like, make it chilly, super dark, white noise, and then just scheduled militant time of like bedtime. Hard stop at 9:30, whatever the time is, and just get to bed. And that was the first thing I recommended. I was like, okay,
yeah,
I'm going to do it.
My family makes fun of me because I wear earplugs. I got a face mask. I started mouth taping. I mean, it's a whole project.
Yeah, it was good.
Yeah, but it works. But like everything you said, cool room, like sleep like you're in a cave, dark, cold. I don't want to hear anything, see anything. So yeah.
Have you tried the white noise? Have you dabbled in a little bit?
I have a little bit. I just like the earplugs.
Okay.
Yeah, that's kind of my thing.
Gotcha.
Yeah. People do love that.
Sometimes they'll do both.
Okay.
I'll do earplugs and white noise. Okay. Because I think I got used to the white noise when my daughter was first born 3.5 years ago. She was in the bassinet in our room.
Oh, yeah.
And we had white noise for her in our room. And I was like, I like this a lot. And then she left and had her own crib. And I was like, Nicole, can we like get our own white noise in here? She's like, we won't wait our daughter. We like if she cries, we can't hear her. I'm like, oh yeah, I forgot about that part. But anyway, I'm a fan. The white noise makes a difference for me at least.
Good.
But yeah, sleep definitely is, I think, very underrated. Mm-hmm. So for you were talking about reversing autoimmune disease. I would assume type 2 diabetes would be on that list of like, not autoimmune, but like you can reverse type 2 diabetes.
Absolutely.
Okay, that's what I thought. I've been telling people that. I'm like, I'm not crazy, right?
You're not crazy.
Type 1 diabetes is one that is congenital, right?
Yeah.
Okay, we can't change that, unfortunately. But type 2 diabetes can be reversed.
Absolutely.
Okay, I thought so. What for people with type 2 diabetes, what do you recommend?
So it goes back to the basics. It goes back to really the big thing there is changing their diet. And I often have them wear a continuous glucose monitor because what spikes someone's sugar for one person may not for another. And so getting that data is really important. So does corn do it? Does rice do it? Does potatoes do it? Do none of them do it? And so getting blood sugar down is really important. But I also think eating more macro balanced meals. So having a protein, a healthy fat, a complex carbohydrate. If they can have those complex carbs, but there might be a season where they need to really just lean into proteins and fats, and then non-starchy vegetables, and then getting them moving. A lot of these people that have type 2 diabetes, they're very sedentary, and so it's not just about getting in the gym for 30 minutes, 3 to 4 days a week. Like they need to be moving throughout the day, right? Not just 30 minutes in the gym and then sitting the rest of the day.
Right.
So movement's a big deal. Getting them sleeping and getting blood sugar down, and then managing their other stressors. And so we do more functional testing, and oftentimes we're finding, they're full of heavy metals, things that really can affect the vasculature, include things like lead, mercury, arsenic, cadmium. Those are the 4 vasotoxic metals that we really want to try to reduce their exposure and get them out. We get them sweating. Sweating is such a great way to detox, right? Getting their bowels moving. I mean, oftentimes they have something called autonomic neuropathy, where their guts just don't move very well, right? Their nervous system to their gut doesn't move. And so getting them regular. And so it's kind of a whole
What leads to that?
sugar in the bloodstream.
Just excessive.
Yeah, excessive, like an insulin resistance. Yeah. Yeah.
And the main thing that creates insulin resistance is just too much sugar in your diet.
Basically, I mean, you've banged on that door of needing insulin for so long because what insulin does is it pulls that blood sugar into tissues, into muscle and organs for use for energy, right? But when it's constantly present, that kind of signal dims, and so it's not as reactive to bringing it in. So it hangs around in the bloodstream, it hangs around the nervous system, and then things, shut down.
Right. Interesting. I know, because I never heard it before. The autonomic response to the gut, and it shuts down. Interesting.
Everything kind of just dims, right? That's the way.
So the reversal for that is we need to clean up the nutrition component. Mm-hmm. We need to eat more purposefully. Protein, carbs, fats appropriately.
Yes.
Introduce some movement, and even better, maybe a purposeful fitness regimen.
Yes.
That's appropriate and builds over time.
Yep.
Get moving throughout the day, not just when you're working out. Fix your sleep time and consistency. And then what was the other one?
Removing stressors.
Stressors.
Whether those are environmental, psychological. Yeah.
And that combination over many, many months will lead to like, hey, my A1C is improved.
Absolutely.
Cool.
Totally.
Versus like, I'll just take an insulin injection every day.
Which is only adding insult to injury and creating more weight gain and more difficulty with more insulin resistance. I mean, yeah, that's more late stage and that's harder to do, but I absolutely believe that is doable. It's getting the mind around what needs to happen versus saying, oh, if I take this medicine, I'll be fine.
Yeah, totally. Is it instant gratification, less work needed.
Exactly.
And deep diving not being taken.
Yeah.
That makes total sense. We were talking briefly about sodium. All right, sodium gets a bad rap.
Yeah.
I've always thought that, like, it increases the risk of cardiovascular disease and high blood pressure. We need sodium. Correct.
Totally. We need sodium. Your adrenals need sodium. Your adrenals are your stress glands that sit on top of your kidneys. They're about the size of a walnut. But yeah, you need sodium. So especially if you're an athlete and you're sweating a ton, you need those electrolytes back, right? But if you're hypertensive with already high baseline inflammatory disease, like we've been talking about, you want to monitor that. So everything in medicine is dose based, right? Like a little bit is good, just enough is great, but too much is not.
Can be detrimental too.
Exactly.
What about some of the wonder supplements that I've heard about are magnesium?
Oh yeah.
For sleep?
Oh yeah.
Agree?
Correct. Well, there are different types of magnesium. There are some that are great for the nervous system, some that are good for skeletal tissue, some that are great for the gut. But magnesium, yes, most of us could use a little love for magnesium. Yeah.
So I've been recently introducing a little bit more magnesium, potassium supplements with a vitamin C, ascorbic acid, right? Yeah. Into my daily routine with fish oil and then turmeric and ginger.
Great.
Supposed to be all anti-inflammatory.
Absolutely. Those are all
anti-inflammatory. Is there anything else missing in that list? And I'm going to write this down.
That's a pretty exhaustive list. That's pretty good.
Okay.
Yeah, I like it.
Okay. So for people who are like, I want to decrease my inflammation, right? Or eliminate, from what I've heard too, you clarify this for me, like free radicals, right?
Sure.
Like hydrogen ions or oxygen ions that are free radicals that are the inflammatory responses in your bloodstream. Is that correct?
They're part of it. Part of it. How do I want to answer this? So taking supplements are great and they supplement or they bridge. But I think what you ultimately have to do is remove the inflammatory items and give more presence to those things that are going to have antioxidant potential, right? And so you can't take the supplements and keep eating what you're eating and expect a difference.
Yeah. You're just trying to solve a problem but still doing the problem.
Exactly.
Why not just remove the problem?
Exactly.
I see what you're saying.
Yeah.
I love that.
And I think most of those things that you mentioned can be found in our food sources, right? Our food source isn't perfect by any means, but like I really would rather patients just eat wild caught salmon and flax, chia seeds, walnuts, pecans to get their omegas that way versus a capsule. I would rather them do seeds, nuts, and especially females need more magnesium, especially around their cycle. So yeah, everything. Again, I think supplement.
Yeah, I got you.
Yeah.
Makes sense. Would you recommend for people then, like at some point, to wean off of the supplements? If you remove the inflammatory lifestyle habits and nutrition stuff they've been eating, take supplements to make it better, remove those things, and then eventually remove the supplements too?
Potentially. Yeah, potentially. I don't think when you sign up for taking something, it's for forever. Everyone's needs change based upon so many different factors. And so for me personally, I do notice when I'm not taking the supplements that are kind of in my regimen right now. Like I was having surgery, and so I had multiple surgeries over the last few years. And so I needed certain things to get me through post-operatively, right? But even now, I have some different things. So those things shift, maybe is the best way to answer that.
Gotcha. Yeah, based on what's going on.
Sure.
That makes total sense. That's interesting. How you been feeling after surgery stuff?
Oh, I feel great. Thank you.
Okay, good.
Yeah, IV nutrient therapy, supplementation, getting rest, taking a little time off work. Those were all things that were really good for me. And so I feel great. Thank you.
Are you still working out at Metabolic?
I am.
How do you like that?
Oh, I really appreciate their programming in the sense that it's very mindful. We go back to that word. And so I'm an athlete. I grew up playing sports. I still love sports. And so I feel like the movements are very intentional and they don't push you. They really kind of are leaning into what you individually need. And so they're like different lanes that you can kind of shift between based upon kind of where you're at. And so
intensity.
Yes, exactly. Or weight is really where probably the difference comes. But post-operatively, I've really been doing lighter weights, but I still love to get in there and sweat. I love to sweat. So it's been, and the coaches are great, very knowledgeable, and it's just a great environment. It's very encouraging, very lively. We're all starting and ending at the same time. So there's not this, I got to finish before you. Like, no, we're all in it together. We all start and finish together. And I love that.
Yeah. That makes sense. Like I had to hurry up and finish. They finished first. I'm still going. I would like test taking. It'd be the same. People would turn their tests in. I'm like, I'm still on like 14 of 30. How are you done? That's totally. It's kind of discouraging sometimes.
My favorite part of MAD is every class, there's a striking portion. And so that bag is like my therapy. It is awesome. It is like the best way to
punching bag.
Yeah, it's a punching bag. Yeah, they call it striking, but yes.
Yeah, gotcha. They have a unique model. I like that. I went there a couple times. I met Zach a couple times. Zach's the owner, correct?
Incredible.
Yeah.
Yes.
Head coach.
Yes.
Right?
Yeah.
Okay. Cool dude. I actually ran into him at Harborside on this Halloween event, fall Oktoberfest thing.
Cool.
With our kids, and I was like, I know you. But yeah, the striking part's a really cool component.
Yeah.
So you played sports. You were basketball, is that correct?
Yeah, played ball, and then I played tennis. I danced. I tried soccer for a hot second, but I was terrible. So yeah.
Did you play college ball?
I did not. I was pre-med.
Yeah, you had to focus.
I had to focus. Looking back, I would have loved to maybe tried, to kind of walk on. I went to Palm Beach Atlantic. I might have been able to do that, but yeah.
Yeah, you had to focus.
I had to focus.
It's an animal.
Yeah.
And it's like 1B and you're like done. My roommate in college, he was pre-med and he was like, he's super smart dude, he also got like the only academic scholarship that's like the #1 academic scholarship for the whole school for like each class. And he was the one that had it. So he, there's some expectations, but he also pre-med and like he was studying all the time. He enjoyed it. He was good at studying, and like doing good in school. Not always my thing, but that we won't go there.
I think you're doing pretty well, Kyle.
I appreciate that. But he had to, he was definitely grinding, like he had to do extra stuff and like definitely hustle. So I can appreciate that. So what about now? Pickleball is your thing, right?
Yeah, I love the game and it is blowing up.
It's huge.
Everyone's playing it. Yeah, it's so addicting. You've played.
A couple times. I really like it. I was like, just because the couple sports I really never played was tennis and hockey. And I would have loved those things. I just never really played them. But I was like, pickleball, I played ping pong. I was like, it's a mix of like tennis and ping pong. It's just a more manageable version of tennis.
Yes.
It's just not as big. It's more manageable.
Yeah.
And I was like, I like this. Like, I'm not going to go play tennis, but like pickleball, I could do that.
You were natural, weren't you?
No.
You weren't.
No, I was not. I had,
Okay.
it wasn't my thing.
Okay.
I had to practice for sure.
Sure.
But I did see, so my wife and I would take our kids to like all these local playgrounds and stuff in the community. And the one right next to Palm Beach Gardens High School on Lilac.
Yeah.
There's soccer fields behind that playground.
Yeah.
They knock all that down. It's all pickleball courts now. It's behind the playground, behind Palm Beach Gardens baseball field. And then on the other side of the pickleball, where they play pickleball now?
Yeah.
Yeah. I think they're changing that into an ice rink, my understanding.
Wasn't it originally an ice rink?
Yes. It was. I was an outdoor hockey, roller hockey.
Roller hockey. Okay, cool.
But they made all new, like there's probably 10 pickleball courts.
Are those the ones
12.
that are going to be covered?
I think so.
Yeah.
I think so.
Yeah, because when it rains, what do you do?
Yeah, exactly. Or when it's like 99 degrees outside
Exactly.
in summer,
Exactly.
which summer here is like March to November.
Right.
But yeah, the whole thing is pickleball courts now.
Very cool.
Yeah.
I haven't been there.
I was like, I haven't been here in like maybe a month or two, but I'm like, man, within the last 6 weeks, this has completely changed.
That's awesome.
It's crazy. So pickleball is blowing up
It
for
really
sure.
is. Yeah.
And you play competitively, right?
I took a break with all the surgeries and work kind of building over the last year, but I would love to have my season where I'm really leaning in. I found that when my pickleball was going well, my work was suffering and vice versa. So, right now I got to lean into the business. But yeah, I would love it eventually to really train. I mean, you've really got to be at that competitive level. You got to play every day, sometimes twice a day. And I just wasn't getting enough touches to really compete at the highest level. But yeah, I mean, I was playing in open tournaments, not pro level tournaments, totally different, but I was playing in open.
Still, it's awesome.
Yeah, it's fun.
Impressive.
Yeah, it's great.
That's cool.
Thank you.
We'll have to I want to get out there again at some point with some people I was playing with. We'll see.
I'll play with you and your wife.
Nicole is natural too.
Is she?
Yeah.
Awesome.
She played soccer in college, so she's had that genes.
Yeah. Okay. Cool.
But yeah, totally. Well, I would say in closing, because we'll have to do another episode for sure and talk more details about other aspects of the practice and what y'all do, and then maybe some other nutritional stuff.
Sure.
But what would you want to leave people with? Like what Wellness First does, how you feel like you can help them, like what would you want to say?
If you feel like you're kind of banging your head against a wall with the conventional model and are really looking for someone to take full ownership of your health, then I would say call us, because we do screening consultations for everyone to make sure that they understand exactly who we are, what we're about, and if we're a good fit for them, because I recognize I'm not the doctor for everyone, nor am I trying to be. And so if that's something that they need, that interests them, then absolutely would love to hear from them and spend a little time getting to know them and see how we can help.
Gotcha. Cool. That's awesome. And I think it's also important. I mean, we try to do the same thing. We're not the physical therapists for everybody.
Sure.
But at least if we talk, we can give you some direction on like maybe where to go next.
Yeah.
Where can people find you? Like website, Instagram?
So wellnessfirstjunobeach.com. That's also wellnessfirst.junobeach is our Instagram. We're 13901 US Highway 1 Suite 5. Our office number is 561-491-4666.
Cool. Okay, awesome. And you guys are you're on the corner of Donald Ross and US 1.
Yes.
Right next to Thirsty Turtle.
Yes.
Okay.
Across from Papa Kwan's.
Yeah.
Love to go there.
Cool. Oh, yeah. Totally.
It's great.
Well, awesome. Well, I appreciate you coming in.
Thank you for having me.
We'll definitely have you on again.
Oh, fun.
It was really
great.
fun. Yeah.
Cool.
And if y'all need any questions, always reach out. We would love to answer questions and share shed some light on some questions y'all have, and at least point you in the direction you might want to go. But you can find us at Athlete Restoration Co. on Instagram or athleterestorationcompany.com. And the best email for us is our team email, team@athleterc.com. And we're looking forward to having it again, and we'll catch y'all next time. Hey, hold up. As you know, we're a small local practice, and we don't run any ads or sell anything on this podcast, but it would mean the world if you could share, write a post, or word of mouth recommendation for somebody just like you that's athletic and active that wants to live their dynamic lifestyle and pay some good karma and pay it forward to somebody else just like you. And who knows, you could change their world, and a 10-second review could be that avenue.